Our webinar will begin shortly. Attendees are still joining us, so we will begin momentarily. Well, thank you for joining us as we talk about the impact of COVID-19 on seniors with hearing loss. I'm Christopher Sutton, the Chief Executive Officer here at Wavefront Centre for Communication Accessibility. We're very excited to have an excellent panel with us today to discuss this very important issue as we kick off Better Speech and Hearing Month. But before we do that, I'd like to do some housekeeping to let you know how some of the various features work for our webinar today. This session is with communication access, including a sign language interpreter and closed captioning. Please click the CC button on the bottom of your screen to enable the captions, and the sign language interpreter is spotlighted, so you'll be able to see them throughout the presentation. We also advise you to use the gallery view in the view section so that you'll be able to see the presenters, their slides, and the interpreters at the same time. For any technical issues, please use the chat button, and one of our members will be able to assist you to help with any technical issues you may have. The question and answer button is where you should be able to address any questions you have for the presenters, which we will present at the end of our session today. But before we begin, I'd like to take a moment to acknowledge the Indonesia's people and all the lands that we are on today. I know that people are joining us from coast to coast, and we're meeting on a virtual platform. And I'd like to take a moment to acknowledge the importance of the land which we call home. We do this to reaffirm our commitment and responsibility in improving relations between nations and improving our own understanding of local Indonesia's peoples and their cultures. Today, we are very pleased to have a panel of some wonderful speakers, including Ms. Isabel McKinsey, Dr. Ruth Warwick, Henry Lamb, and myself. And today we're going to talk about the impact of COVID-19 and this global pandemic on seniors, particularly those seniors that are living with hearing loss. Ms. McKinsey has spent over 20 years experience in working with seniors in home care, licensed care, community service, and volunteer services. She led the biggest not-for-profit agency in British Columbia, serving over 6,000 seniors annually. In this work, she led the implementation of a new model of dementia care that has become a national best practice. Prior to her appointment as a seniors advocate, she served on a number of national and provincial boards and commissions, including the BC Medical Service Commission, the Canadian Home Care Association, BC Care Providers, and many more. Dr. Ruth Warwick is a founding member of the Canadian Hard of Hearing Association, the former national president and president of the BC CHA Vancouver branch. She serves currently as the BC chapter of the Canadian Hard of Hearing Association, and she's also the president of the International Federation of Hard of Hearing Persons and first vice president of the International Disability Alliance, a network of international disability organizations. She's also the past president of the Western Institute for the Deaf and Hard of Hearing and the BC Family Hearing Resource Centre. Most importantly, Ruth is a huge advocate and a consumer for people living with hearing loss. Next, we have Henry, and he is a registered audiology who has worked at Wavefront Centre for Communication Accessibility since 2004. He has been the interim department head for audiology for the past 2.5 years, and over his career has worked for two of the largest not-for-profit agencies in Canada, serving people who are deaf and hard of hearing in Ontario and British Columbia. So as you see, we have a very excellent panel today to be able to discuss this very critical issue. And first, we're going to start with Isabel McKenzie. Thank you.
Thank you very much for that introduction, Christopher. And I'm just going to share my screen here. And I am going to ask for a thumbs up that somebody can see my slide on their screen. Brilliant, and thank you. Okay, so COVID-19 on British Columbia seniors. So I thought we'd start just by taking an assessment of seniors in British Columbia and who they are and where they are and how they live. So in 2021, we passed a milestone in BC. We now have over 1 million people age 65 and over. That's about 20% of our population. But I think it's important to reflect on the fact that 8 out of 10 people are not age 65 or older in the province of BC. So the majority of the people making decisions and the majority of people they're making decisions for are actually not seniors. And that's an important perspective to understand when you look at the issues and the attention that some of the issues are getting. When we look at where seniors are living in British Columbia, and this is particularly important as we look over the span of this pandemic, the vast majority of people age 65 and over live independently. Even at age 85 plus, you still have 7 out of 10 British Columbians living independently. You have about 10% in what we call retirement living, assisted living, and about 15% of people 85 and over live in long-term care. So while long-term care has been in sharp focus during this pandemic, and while there have definitely been issues identified and issues that need to be addressed in long-term care, it is not where the majority of British Columbia seniors are living. And there are issues for those who live in the community that are as acute and urgent as those who live in long-term care. The median income, so half of British Columbia seniors live on less than $30,000 a year, and a full 28%, almost a third, are on the Guaranteed Income Supplement, the GIS. And to put it in perspective, these are people whose annual incomes are less than the minimum wage job would provide. So we definitely do have an issue, a significant number of our seniors, as I say, almost a third, or close to 300,000 of our seniors who are living on very limited incomes. 27% actually have an income under 20,000 a year. So when you start thinking about some of the expenses and some of the additional expenses imposed by the pandemic, there's some very limited incomes amongst a significant portion of our seniors. We see a growing proportion of younger seniors continuing to work. This number of 30.4% was 24% when I started giving this presentation about 5 years ago. So I expect we are going to continue to see that grow, and that's only natural. People are living longer, they're living healthier into their older years, and the generations that are coming up are beginning their full-time attachment in the labor force at an older age. They're more likely to pursue post-secondary education, more likely to travel, more likely to wait before they start that 40 to 45-year journey of working full-time. A big chunk of seniors volunteer. I don't need to tell probably most of you on this call about that. Probably a good number of you are contributing in a voluntary way to making your communities better. Seniors are the most prolific volunteers we have there. One of the things an issue we do have to think about is that at the age of 65, 9 out of 10 of us have a driver's license. And by the age of 85, that drops to less than 4 out of 10. And yet we're living independently. We're wanting to get out and about, but we aren't able to drive a car in the way that, and the freedoms and spontaneity that offers. Also want to look at living alone and really reflect on this as we think about the impact of the pandemic. So in the 25 to 64 age group, about 10% of people live alone. Once you get to 65, it doubles to 20%. And then you can see how at every age increment of 5 years after age 70, it continues to go up, and 4 out of 10 people aged 85 plus live alone. So think about what this pandemic has been like for those who are older. So they are at most risk from this virus, and they live alone in much greater likelihood than younger people. They are much less likely to have a car they can hop into and drive around and get a sense of getting out there within the safety bubble of their vehicle. And they don't have that much money. So, there are many reasons why there's been this disproportionate impact on seniors in this pandemic, and I'll talk about that a little bit more. So where have we seen some of the biggest impacts on community dwelling seniors, which is where most seniors live? So think about the fact that our fitness centers, our rec centers, our senior centers, our libraries, all closed very abruptly and for very prolonged periods of time. Most are open in some way, shape, or form. Many have not returned to the full scope of what they were prior to the pandemic. And this group of resources here are very important to seniors. Uh, for many, it's how they get out and meet people. They don't live with somebody else in their household. It's how they stay connected to the news of the world, to what is going on. For low-income seniors, it's how they connect to the internet. One of the fault lines that's been revealed is a lot of seniors don't have internet because they can't afford it. And they made do by being able to go to their local library or their senior center every few days and access their email, and that was all stopped. So that has had a significant impact. Churches and places of faith, higher proportions of congregations are older versus younger. This is where people find their connection with other people. It's where they may find the best meal of the week that they have. It's where there are people who um, are there to make sure they're getting what they need. And many of those gathering places right now, they're closed. And over the time of the pandemic, there's been varying degrees of closure in our churches and places of faith. Restaurants, many seniors will go out to a restaurant to eat because they don't want to cook for themselves. They meet up with their friend in the restaurant. That's how they get that. That's all been upended during COVID. The restaurants were open for probably, I think if we look back, I think you'll find most of the pandemic they've been open. But as you know, they went through periods of being closed. They're closed right now. So again, for seniors, particularly those living alone, and we know that proportionately they're more likely to live alone, it's been a tremendous impact. And virtual appointments. So lawyers, doctors, accountants, banks, all places that on average seniors are more likely to visit in person than younger people, have all pivoted now to virtual visits as much as possible. Again, putting up that barrier of not providing that social connection that they have with the person they meet with. And for some, they don't have the technology or the finances for the technology to be able to have that virtual connection. And then, of course, visit restrictions in long-term care and assisted living. While this is a small group of our seniors, this has had a profound impact. And I'm just going to highlight that a bit in my next slide. We did a survey of all the visitors to long-term care and residents in long-term care, and just look at pre-pandemic the frequency of visits that people were having in long-term care. So you find that over half of visitors were going several times a week or daily before the pandemic. And then the pandemic hits, and now once a week or less is how most people are visiting. We've opened up our visits quite a bit in the last couple of months, but this was really the experience for a year for people in long-term care. And in fact, for about the first 3 months of the pandemic, there were no visitors. So, and you can also see the frequency of the visits. So even when, you were allowed your weekly visit, here we go, your weekly visit, you were likely 30 minutes or less, and often with a partition and predominantly in a public area. So and the impact on the residents, This is very startling. This is the use of antipsychotic medication in long-term care. This line here represents the start of the pandemic. What you see here is antipsychotic use over the preceding 3 years. So you can see it bounces around a bit, right? It's not a completely steady line, but you can see the sort of margins it bounces around in, and then it just takes off. Took a little dip, we were hopeful, but it's gone back up again. And this is from September, and it's continued to go up. So there has definitely on seniors in long-term care been a significant, when we talk about the mental health impacts of COVID, I do believe they've been most profound on our residents in long-term care, and we have some robust data to support that. And also when we look at just the overall impact of this virus, this just gives you some concept of disproportionately how it has impacted older British Columbians. So the most marked is obviously in deaths. That's this brown line here. So you can see that here's the blue line tells you the percentage of the population this age group is in general. So, and then the yellow box tells you how many cases. The blue box is hospitalizations. The mauve is intensive care unit, ICU, and the brown is deaths. So what you're seeing here is that, you know, for people under 10, COVID did not impact them as much in proportion to the amount of population they represented. When you look at, interestingly enough, the 10 to 19 age group, you see that proportionately, the cases were on par with the percent of population they represent, but they were significantly less likely to be hospitalized, go to the ICU, and die. I think we have had some deaths of young people. I think we've had 2 deaths in the province of people under 20 from COVID-19. Then you get up into the 20 to 29 age group, and interestingly enough, what you see here is a much higher percentage of cases relative to the population. But again, far lower rates of hospitalization, ICU, and death. 30 to 39, you still see more cases proportionate. So this is where the cases are, right? The 20 to 49 age group, where the yellow line is above the blue line, you're seeing more cases. Then as you cross that sort of threshold of 50, now you're starting to see fewer cases proportionately, but much higher rates of hospitalization, ICU, and death. And then as we continue up the age spectrum, so as we get over age 70, you start to see this really high spike in deaths, intensive care units relative to the number of cases. And here you see it, although the death rate is highest in the 80 to 89 as a proportion of cases, it's highest in the over 90s. So, you know, this pandemic, the impact on seniors has been sort of, for want of a better term, the proverbial double whammy, where the virus itself was far more likely to produce serious illness, hospitalization, and death in seniors. So the virus itself disproportionately targeted older people. Then when we look at all the measures we've taken to contain the virus, those have had disproportionately negative effects on seniors as well, because seniors proportionately much more likely to live alone, less likely to be connected to technology, less likely to be able to drive, and have lower incomes. So although as a part of the total population, they're the smaller number, proportionately, they've borne a larger burden through this pandemic. So what is it we need to do to improve? Because the other, I guess, the upside to the pandemic is it's revealed a lot of shortcomings that many of us who work in the seniors world know about. But the world at large may not be quite as aware of. And I think that through the trajectory of this pandemic has become more apparent. So we need to continue to enhance our community supports. That became apparent when you started to realize, how is this 85-year-old going to get their lunch? How are they going to get their medications? How are we going to make sure they're okay? And a lot of community goodwill came forward, and I think we're going to be able to build on that as we move into the future. We need to increase benefits for low-income seniors. I think that we have been, the way I describe it is, a low-income senior can stumble along with a bit of duct tape patching things together, but they're one disaster away from disaster, and the pandemic was that disaster. So suddenly, the fact their income wasn't sufficient for their food, but they managed because they could go to the senior center, they could get their internet at the library. All of those things came to a crashing halt and made us realize the vulnerability of our low income seniors. And also digital literacy programs for seniors. So part of it is obviously the resources, the money for the internet connection, the money for whatever device you're using. But the other part of it is just a reinforcement of the need to promote digital literacy, but to also appreciate that there will always be digital illiterates, for want of a better term, that you can't design the world based on everybody can do everything digitally, and we just need to go out and train them how to do it. That, I think, is a very dangerous precedent to build on, or I guess precedent isn't the right word, platform of assumptions to build on. There are always going to be people for whom it will not work for a variety of reasons. Without a doubt, we need to improve long-term care. We're a bit better in British Columbia than they are in Quebec and Ontario. We've got newer infrastructure. We've got better staffing, not as good as it needs to be, but it's better than Ontario and Quebec. But we certainly need to see those improvements. And we need to address what I call the invisible barriers. And I've spoken to Ruth and some of her colleagues as well, and it's something that this office is looking at with a senior's lens, which is these invisible barriers. Hearing loss is one, and the other is vision loss. And from the perspective of seniors, a big part of the concern is that in the older adults, the presenting symptoms is the word I use in my world, but of a person with hearing loss or vision loss can be misinterpreted as cognitive impairment. We wouldn't do that in a 30-year-old with severe vision loss or hearing loss, but we do it in 85-year-olds. And it's because it's an invisible barrier. So if you see somebody who has physical challenges, it's obvious. You can see that they're physically less able to do this or that. But when a person has a hearing loss or a vision loss, it's not apparent immediately that they have that loss, and it is a growing concern that we are not recognizing the impact of that in older adults in BC. And we also need the voice of seniors and those who love them to play a bigger role in determining how needs are met, what the standards are in meeting those needs, and how those standards are I'm looking for a word other than policed, but that's the word that comes to mind, is how we are ensuring that the standards that we set are met. And I think that certainly became very clear when we looked at the visit restrictions in long-term care, that we have marginalized the voice of those affected in favor of the voice of those who are providing the services for those who are in need of them. And I think that is a balance that needs to be seriously corrected in the years ahead. So I know we're going to do questions and answers at the end of the presentation. So I think I will stop my screen share, and I think, Christopher, am I turning it back to you or over to Ruth now?
Thank you, Ms. McKinsey. I think that was those insights were very powerful, and I think it's a good segue to Dr. Warwick now, who will talk more specifically about seniors living with hearing loss.
Thank you.
Dr. Warwick, you're on mute.
I will share my screen, and also I will unmute myself.
Why don't you, perfect.
Excellent. So I'm very pleased to be part of this session, and I will be discussing seniors as well as people in general who are living with hearing loss and the impact of the pandemic, which has been huge. And Isabel has well described its impact on seniors. You add to that a hearing loss and you have a double whammy. And here's a nice little quote about the impact of the pandemic. While mask and social distancing are undisputed allies in the fight against the virus, these create additional obstacles for people with hearing loss. So the very tools that have been used in society to fight the pandemic are the very things that create barriers for us. They create communication barriers. And we, at the international level, did a study on this. But let's first of all look at the factors. We're talking about face coverings, social distancing, and also different service approaches. As Isabel mentioned, moving more to virtual meetings, people who are not working at the office, but are working from home. And the impacts on us have been communication challenges. Going to the local grocery store can be a nightmare now because if the clerk asks you a question, it then becomes a challenge to figure out what's being said. And so what should just be a simple transaction becomes a communication nightmare. And I once explained this to a clerk recently because I think I was feeling a little frustrated having this experience over and over again. That her asking me additional questions that I couldn't understand were actually not adding to our interaction. But we'll discuss better ways of dealing with this. And so what happened is exactly well-being has been affected. You add on several of these negative experiences where you can't understand the other person, and then you begin to feel bad about those interactions yourself, and it affects your well-being. And then the challenge of adapting to new ways. And of course, some people are earlier adapters, and other people, it's much more difficult. But exactly what impact has covered mask had on communication? So the International Federation did a survey, it was last summer, and so it's a little bit out of date now, but the information from it is still valuable. We had 166 people all over the world and really good representation from Canada. So over 90% of people are unable to easily understand someone who has their face covered. So that means that only 10% of the people who responded have no difficulty, and 90% of us are struggling. And even when we ask the person to repeat themselves, it still is something that we don't understand. So the old strategy of when you didn't understand someone and you asked them to repeat themselves, then at least you had a bit of a chance of reading their lips and figuring out what was said. But with a covered mask, you can't do that anymore in most cases. And then the upshot of it is not only more frustration on our part, but we're experiencing the other party being a little more impatient with us, at least 50% of the time. And then there are some of those people who are absolutely fabulous and who are wonderful and who will go out of their way. Absolutely. Don't want to discount that. But still, if the survey is saying 50% encountered kind of a negative reaction, then that makes one want to limit those social interactions even more and isolate even more. Social distancing, having to be far apart, even when I watch TV, seeing that huge distance between the people, and even on TV, people wearing their face masks with captioning, that's another medium that has been impacted. So definitely hearing's more challenging. And there's limits on the number of people who can be in our social circle. And I have a friend who just recently went to the hospital, and I'm in the bubble of the friend, but other people who are friends, they can't visit him because they're not in his bubble. So he's isolated and lives alone, and has only me actually as his contact to assist him because of the pandemic. No family here. And this isn't an isolated case, I'm pretty sure. So yes, we're leading into the next bullet, which is isolation and loneliness has increased. And the next one bullet is kind of interesting because I recently did an academic article about this, and I came across some studies that suggested that for some people, they actually found fewer communication partners and situations as less stressful. Yes, absolutely. If you don't have to talk to anyone, then you don't have the stress of that. And if you're not out in the world, you don't have the stress of that. But what is that saying about the kind of life you're leading? It's a very isolating life. And one of the interesting aspects of this pandemic will be after it's over, will we go back to being social beings as we used to be? Or will we keep some of these isolationist tendencies? I think that will be an interesting study in and of itself. What people said in the survey, I wanted to highlight some of the quotations because I think they resonate with a lot of what people have been experiencing. Losing body language and facial expressions have meant that messages are misinterpreted, misunderstood. So there's the fear of using public transit. So if you actually can meet somebody, you don't want to because you don't want to go by public transit. And not only are seniors affected financially, but also people who are hard of hearing. I don't have the actual stats, but we know that people who are hard of hearing make less money. So it's not like they have the option of having a car to use or taking a taxi. Increased anxiety levels due to possible communication issues arising from mask use and lack of video calling facilities. So lack of having internet access. So there's the two issues, not having access to the system because you can't afford it, or if you do have it, you don't know what tools to use because it's complicated. You almost have to be an engineer to figure out everything. And then negative attitudes towards people, feeling that there's a failure on our part to understand. And Isabel mentioned the issue of stigma. Stigma with hearing loss pervades all age groups, but I would hunch that it increases as one gets older. I myself have been hard of hearing since birth. And I can remember when I was in my 20s, I talked to somebody on the phone and then I met with that person and they said, oh, I'm shocked that you're so young. I thought you were old and decrepit. And, it didn't just say old, but he added this negative adjective. But I had that perception that I was still being stigmatized. So the different service approaches, telemedicine. Telemedicine is potentially, these are some of the different service approaches. And the pandemic has showed us that some of these modes actually can work for the future, but not for everyone. And it has to be flexible. So telemedicine, in my contact with my doctor, I have actually, fortunately, I've been able to hear over the phone. So many hard of hearing people cannot hear over the phone, but I've actually had more contact with my doctor during the pandemic than I had before, because it's so easy to have appointments. But if you're not able to hear over the phone and there's no captioning provided by video, then that becomes a barrier. Online meetings. And again, some online meetings, if there's access for hard of hearing people, can work well if you know how to access it. But if you don't have that, then it becomes a barrier. And the change in our society of working from home, it's wonderful to have those options, but it also limits the in-personal interactions. So what can we do about this? Well, first of all, I want to describe what Shaw BC is doing. One of the things we're doing is we're producing a new hearing access publication for consumers. It's I saw a draft of it this week, so it will be ready in a few weeks. And for the first time, we're doing one specifically for healthcare professionals, just outlining what they can do in terms of hearing healthcare access in general and during the pandemic. We're undertaking an accessibility campaign to increase the use of assistive technology and tabletop loop systems. So I had the experience with my library where I couldn't understand the person at the counter. And I asked her to write it down, but she kind of refused to do that and just kept saying the same thing over and over again, which didn't work. When I went back the next time, I first of all said I'm hard of hearing, and immediately the person went to get a tabletop type of loop system, and the interaction was like night and day. And then the third time I went back, I had the same person I had from the first interaction, and I asked her if she would use the system, which she did. And again, it was like night and day. So we really want to promote this. We've been advocating for captioning as an option in healthcare facilities. So for hard of hearing people who don't use sign language in most cases, when we go to medical appointments, we need to have access, or if we're in the hospital, we need not to have things misunderstood. So we need to have captioning as an option covered as a service in medical interpreting services. And I think we're going to make some success with this, but it's still in progress. And we've also been promoting Clear Mask in conjunction with other services. So the use of assistive technology, but definitely Clear Mask is one of the options. Now, what can we do as consumers ourselves? First of all, key is self-disclosing about the hearing loss. So if the other person doesn't know you have a hearing loss, they won't know why you're having the communication difficulty, and they might assume, like Isabel said, they often assume that it's mental incapacitation. I mean, I've experienced that all my life, and even though I have a doctorate degree, I still experience it. Use your own personal assistive listening device. If you're not familiar with this, get to know this. We have to take ourselves out of our comfort zone and really make use of the tools that can help us. And the automated apps, I'm totally a fan of some of them. They've way improved, but I'm also a fan of the professional services. Don't get me wrong, certainly when it comes to a public meeting. But when it's a one-on-one thing, use of automated apps, or you can't always have technology with you when you're going to the grocery store. So have pen and paper handy, and then be your own example and wear a clear mask. So I have now a stack of clear masks because I have to be an example. Practice what I preach. And finally, let's make use of some of the services to reduce isolation and loneliness. Thank you, Henry, for wearing your clear mask. Shaw National has a mentoring program. So we will set up someone with a person who would like to be mentored one-on-one. And that person can walk you through the technology, can walk you through a whole host of things. It's a fantastic program. And then locally, we have the Better at Here program or Better at Home program of the Wavefront Centre. And it's a terrific resource. And when I'm in my 80s and 90s, I plan to make use of this program. right now, I don't think I need to, but I'm glad to know it's there one day. And if you need it, please make use of it. Thank you so much for your attention. I'll turn it back over to Christopher for the next speaker and stop sharing my screen.
Thank you, Dr. Warwick. That was very, very insightful. And we thank you for all your work and advocacy for our communities. Next, we have Henry Lamb, who will speak for a few minutes. And just a reminder, if you have any questions, please put it in the Q&A box, and we'll be able to address them when we have some time shortly.
All right, thank you, Chris, and thank you, Ruth and Isabel, for really setting a stage. Now, I'm wearing the clear mask, and there's a benefit where you can hear me. No, sorry, not hear me. You can see my lips a bit better, but it does muffle my voice a little bit, and there's some reflection. But like Ruth said, you can be an example. You can have something like this and wear it around. I have one of my clients who always wears one of these, but we're coming up with issues with hearing aids. So you have said hearing aid, and we're pulling them off.
Oh, yeah.
This is happening a lot and getting tangled. So it is tricky to work around with it. You kind of have to do it in the right order to take off the hearing aid and everything. It's what a lot of people are mentioning when they're coming into the office with me, because the things are getting tangled. So if you're able to kind of slowly unfurl the loop of the mask, or try to keep the hearing aid on the inside and the mask loop on the outside, then there's a little less tangle with it. So I can see Ruth and Chris nodding in agreement. So I think I'm hitting the right nail for that one. If you want to know more about masks and the different kinds of masks out there, I'm going to plug for CHA National and Wavefront. We did a collaboration on videos. We're doing a video series that's coming out. So look for that in your mailbox, because you'll get some stuff, and I'll talk about the different masks and such. I really like what Ruth said about self-identifying, self-disclosing that you have a hearing loss, because that really sets the stage. That's a great strategy, because you don't want people to assume, and just like Isabel said, Dr. McKenzie said, they will assume cognitive impairment. That's not right. If you say, I have a hearing loss, then they can understand. We start on the right foot right away. You may already be lip reading and you don't even realize it, but you probably do notice when someone is able to safely take off their mask and step back a little bit, or maybe they're behind plexiglass, you will understand a lot more. So if the situation allows for it, you may have to request that they take down their mask temporarily. But again, you have to kind of assess that things are safe to do so. You might not have a cell phone or smartphone yourself, but a lot of people do. And just like Ruth had pointed to, there's apps out there, or maybe a person can type something onto their phone and just for you to see. That would help to reduce some of the confusion about what is being said. The other thing that you could do for yourself is to prepare and kind of plan ahead, because you want to know, okay, where am I going? What am I doing today? I'm going to the supermarket. You can kind of mentally prepare for some of those conversations ahead of time. And that kind of prepares your brain to receive some of the things. Now, if they're making extra conversation, kind of like what Ruth had mentioned, there's extra sentences that you didn't anticipate, then that can be a problem. But if it's most the run-of-the-mill supermarket, credit card or cash kind of questions, then you're going to follow that easier. The other planning ahead is going ahead during quieter times. It's going to be quieter, and you're going to understand the staff at the supermarket or wherever you're going a lot better. But less people means there's a lot less noise around you. The staff are probably going to be a bit more patient at that time. They're not going to feel as rushed. So those are things to think about there. The other thing I want to touch upon is, I guess, well-being and mindfulness. During this pandemic, we've all experiencing a certain level of anxiety in the background. It hasn't been helpful. I'm seeing in the chat things about worrying about communication. It's just creating that anxiety. The pandemic certainly hasn't helped, but because you have a hearing loss, you're also working a lot harder than someone else who doesn't have a hearing loss. Hearing loss really makes you work to understand the communication. So from time to time, your mind needs a break. And so you might want to consider something of the mindfulness or well-being, mental well-being kind of solutions. So there are apps out there that are tailored for mindfulness. Some of them are paid, some of them are free. Sometimes there are videos on YouTube that are targeted for mindfulness. There are podcasts out there. So things that you can look for that will just help to reset yourself and hopefully just kind of take you away from all that extra anxiety and extra work related to hearing loss and related to the pandemic. Even things like yoga, your favorite piece of music, just kicking back with that, and some exercise that often will just help to make sure you're in a good mental space and ready for the communication that's going to come ahead, because it is a lot more difficult right now. And that's really my short little bit there. So I'll pass it back to Chris.
Thank you, Henry, for that. And that was some very good strategies and coping strategies that people living with hearing loss can definitely benefit from. I actually learned a couple myself that I might try to engage. I think the last year has definitely been a roller coaster. There's been so much information overload for people. At times it's been very confusing. And I think it's been a very, why it's been a very difficult year for so many. I think there's some highlights that have come out of this year as well. I do believe that communication accessibility has really been able to come to the forefront, a lot of discussions. I know Wavefront, Canadian Hard of Hearing Association, and many other organizations have been working with government to make sure that communication access is available when there's government announcements, that there's translations available in sign language, and that there's ASL interpreters available for these critical and often life-saving announcements. So that's been very important. I think some of the other things, the conversation about communication challenges and communication barriers is something that's going to be much easier. And I believe to somewhat the pandemic is maybe reducing some of the stigma towards hearing loss, because so many people with typical hearing have been also encountering barriers to access to communication, whether because of plexiglass, masks, and so forth. So I really think that these are some of the things we can celebrate from this year, to see that we've been able to make strides and be able to accomplish things. I think there's been a lot of work the last year as well on, I myself have sit on a number of committees, both here in British Columbia and nationally, that advises the government on the impact of COVID-19 on people with disabilities and seniors and so forth. And I really do believe that the government has, in many opportunities, really been very considerate and really taken our needs into consideration and built that into the plan as they ramp out. There definitely hasn't been a playbook as we address this pandemic, but I do believe there's many opportunities as we move forward to be better prepared and equipped in the future. Here at Wavefront Centre, we have seen a massive increase in the needs of helping our consumers, whether they're deaf, blind, or hard of hearing. Definitely, we've seen an increase for seniors who have needed services, assistance, whether it's through our Better at Home program, whether it's through our TAPS program for people that are deafblind, and really have seen the continuous need to provide these direct services. And as we've also seen, and I think it's been very clear from Ruth's presentation, is that, and Isabel, is that seniors with hearing loss tend to be underemployed and have less income and so forth, and access to virtual services such as the internet and all these many platforms that have been out there haven't been possible. So Wavefront and our essential services have been there meeting with people and continue to meet with people throughout the past year. In the next couple of weeks, we'll be announcing a webinar really being able to discuss the impact of COVID-19 on the deaf, blind, and hard of hearing communities. And that was a survey conducted through our community research department here at Wavefront in conjunction with the Canadian Hard of Hearing Association. And I think some of those findings from that survey are going to be very important to highlight. And there was a tremendous response. So I do look forward to that webinar in a couple of weeks that will address this. And I think I know myself as a person living with hearing loss, I'm very grateful for the facility that we work at here at Wavefront, and that it's really taking consideration complete built environment for all people, including seniors, and that once we get out of this pandemic, that this resource and facility is going to be such a great benefit for all. So I see that we're getting close to the top of the hour. So right now I'm going to look at our question and answers, our questions from our members today, and ask them to the various panelists. So the first question I see, is the clear mask approved by Health Canada? Would Ruth or Henry or even Isabel have a response for that?
I can say that from what I understand, there isn't a clear mask for medical use that has received Health Canada approval yet. This is still something that is under development. It takes a long time for such a product to come to the fore, and that's been one of the challenges in the use of clear mask. The other challenge is just getting people to know that even in non-medical situation, there is the availability of clear mask.
We've been working with a company locally here in BC on something like this here. I think it's starting to be available. It's by Tinkerine, but it's not officially Health Canada approved, but it is supposed to be, they're aiming for like a higher level because there's a filter in here. So I'll just put this on for demo. So you just have to, whoops. You have to really get it in the right place with the right angle to see it. But there's a filter and it's a higher filter. But I think some of you are probably going to struggle with how my voice sounds right now. Because once I do that, it sounds a lot better. But like that, it's quite muffled. So, but this is a potential thing. But my understanding, it's not Health Canada approved yet. But there are companies working on these things.
Thank you. The next question we have from the audience, and I can direct this to either Ruth or Henry, is when doing virtual appointments with a doctor, how can I get closed caption while I'm talking to the doctor? What is an automatic app, and where and when would I use? And what are some of the apps that you might suggest to try?
I'll let you go first this time, Henry.
First?
And then
Okay.
I'll follow up.
I have to call up some info here, but there are some speech to text apps. Now it's tricky because when you're doing a virtual appointment, you're inside of their system. It might be something like Doxy.me, could be something like Zoom like this. So sometimes it's hard. Zoom, I think it has some auto-generated options. If you're doing a phone call, actually, I will talk to Yet and see if we can get together. I have some documents that I could share, but there are apps on phones like Live Caption, Texter. These are some names here. Ava, Otter.ai, and one by one of the manufacturers, hearing aid manufacturers, called Phone Act My Call to Text. They all have good points and bad points, and whether it works inside of your appointment is a bit difficult because it's hard to run the appointment and then have this on the side. So maybe you have your appointment running on your computer and then you have the phone on the side picking up the voice. There's nothing that's fully integrated to the best of my knowledge at this moment, but that is constantly changing. So maybe someone has developed or is developing something right now. So I don't know if you know something else, Ruth, that I don't know.
Well, I just want to show you, if you can see this, my app. I've got a cell phone here, and you can't see it because,
Put it,
yeah. So anyhow, it's a fantastic app. It's one of the Ava, which Henry mentioned. And I have actually used this in meetings. It's an automated captioning app. But the other thing I would say is if you're going to use it, then you need the health professional to be looking at the words to make sure that it's accurate because you don't want something misunderstood. The other thing is if you really should, if you can't hear, get a professional captioner, and you can organize that through the Wavefront Centre.
Yeah, so like what we're doing right now, we have a professional captioner working on this webinar so that they're able to be hired through Zoom and you can get everything captioned. And, yeah. I'll just point out Marco answered in the Q&A that there are also things known as video relay services or voice carryover options for phone calls. So you can investigate those kind of things. So video relay would be through video on a computer, but voice carryover is an actual phone where you can read what's being said to a certain degree, but it requires a little bit of investigation there.
Thank you for that. I'm going to ask the last question to Ms. McKinsey, and that question is, how can individuals support seniors during this time?
The biggest way you can support seniors in this time is to reach out to the seniors in your personal life and make sure that they're doing well. And then I think ongoing, as we look to the future, I think we have to, from the perspective of seniors, we need to keep up this building momentum that seniors matter and that we need to make sure that the issues that have been revealed through COVID get addressed, and that is going to be important to keep that momentum going, because at the end of the day, the government is the people. If the people want it, the government will follow.
Thank you for that. And this concludes our webinar for today. I'd like to thank our panelists and all those that have attended today. Those have not been able to access or join us today, this will be posted at a later time. So you'll be able to share this with your friends, family, and others. I'd like to just remind people to continue being safe, to wear your mask, get vaccinated when you can and when it's your turn. And if you're able to, check in with your neighbors, and especially seniors in community. Of course, be kind to one another. So thank you for joining us today, and we hope you have a great day. Check back for some future webinars. We have some coming up in the next few weeks that I think will be very exciting and very much complementary to some of the stuff we discussed today. Thank you, everyone. Have a great day.